You're welcome to my channel. Today I'll be talking about ketamine. Some call it ketamine. Some even know it only as Ketala, which is a brand name. But whether you call it ketamine, or Ketala, let's go. Ketamine is under one brand name that I know of, and that is Ketala. As a matter of fact, some physicians do call it Ketala, and I don't blame them because that is the only brand name that I know of. Ketamine. It is a general anesthetic agent. It could appear in form of solution for injection, and in that case, we're going to find Ketamine 10 mg per ml, 50 mg per ml, or 100 mg per ml. And in this case, also can find the generic as 10 mg per ml, 50 mg per ml, or 100 mg per ml. Administration could be administered intranasally, and in that case, going to give the half of the dose per nostril using needleless syringe or mucosa atomizer device. You may give it per oral, and when you choose that route, you give it undiluted, or you may choose to mix it with the appropriate dose of injectable solution in cooler or beverage, and you give the mixture instantly. You may choose intramuscular route, but in that case, you have to give it deep into the muscle and you choose large muscle mass. You may choose intravenous route and you give it bolus or induction doses over 1 to 2 minutes at 0.5 mg per kilogram per minute. Please don't give ketamine rapidly, and with that, it can lead to respiratory depression. If you are using ketamine for unipolar depression, give it over 40 minutes. And you can also choose to give it via continuous infusion. You may choose rectal route, and in that case, you give 15 mg per ml in solution, or you dilute the 100 mg per ml solution. You may choose the subcutaneous route also, and you even have the privilege of giving it a subcutaneous continuous infusion. Adverse reactions. You might be faced with confusion, delirium, dreamlike state, excitement, hallucinations, vivid imagery, or irrational behavior. The affected individual could also come down with bradycardia, arrhythmia, decreased blood pressure, increased blood pressure, or increased heart rate. Still on adverse reactions, the central nervous system will give us features of tonic-clonic movements, increased cerebrospinal fluid pressure, central diabetes insipidus, pain at the injection site, and anaphylaxis. Might be down with anorexia, nausea, vomiting, cystitis, decreased bladder capacity, frequency or urgency, and sometimes hydronephrosis. Still on adverse reactions, there may be laryngospasm, apnea, airway obstruction, and respiratory failure. Contraindications. We don't give ketamine when there is hypersensitivity to ketamine in the past. When there is high blood pressure, not brought under control, please don't crash the BP anyway. We don't give it until the BP has been brought under control. In psychosis, particularly schizophrenic cases, don't give ketamine. In infants less than 3 months old, no ketamine, please. In cerebrovascular accident, that is stroke, no ketamine. In pharyngeal surgery, no. In severe cardiovascular decompensation, please take ketamine off the table. Note this, that Health Canada has warned that ketamine can damage the liver and the bile duct. Warnings as per the use of ketamine. When used for endoscopy and respiratory tract procedures, be very careful. And with that, there may be laryngospasm, airway instability, and tracheal stenosis can also occur. That may lead to death in the affected individual. The central nervous system will be affected with depression. Therefore, no activity requiring alertness around the time of ketamine use. Discontinuation should be done very carefully, particularly in individuals that is taking ketamine on a long-term basis. Whether there might be withdrawal syndrome, and the future could include psychosis. In post-anesthetic emergency reactions, that can cause vivid dreams, hallucinations, frank delirium, but that would be less common in less than 16 and greater than 65. There may be bladder irritative symptoms. There may be cystitis and hydronephrosis. It may cause increased intracranial pressure or hydrocephalus. Still on warnings, be mindful of the fact that there might be increased cerebrospinal fluid pressure. Also, ocularly, you can be dealing with increased intraocular pressure. So, we may not use this in ocular disorders. In anyone diagnosed with porphyria, we don't use ketamine. Rapid infusion of ketamine or inadvertent overdosage of ketamine can lead to respiratory depression that will kill the patient. In thyroid disorders, keep ketamine off the table. Still on warnings, be careful in cardiovascular diseases, and with that, there may be increased blood pressure, heart rate, and of course, oxygen demand. And that explains the reason why the history of myocardial infarction should be taken in this patient before being jabbed with ketamine. You can, however, in conjunction with your cardiologist and clinical pharmacologist or pharmacist in your jurisdiction, decide to add benzodiazepine, propofol, or you choose to give ketamine very slowly. Be careful in alcoholics, either chronic alcoholics or individuals with binge drinking, and now with acute intoxication. Be careful. Drug-drug interaction. Because the list is pretty long, I will not be able to exhaust the list right here. Therefore, I will leave you with your clinical pharmacologist or pharmacist in your jurisdiction to make that determination. Pregnancy. Ketamine could be used in pregnancy, but with caution. To be at safer end, discuss with your OBGYN specialist. Monitoring. We have to monitor the vital signs, the heart rate, the blood pressure, the respiratory rate, and O2 sat. When and how, we'll measure all these parameters before giving ketamine. 30 minutes after administration of ketamine, we'll measure all these parameters. And 60 minutes after, we'll repeat the same. Mechanism of action. Ketamine is a dissociative anesthesia, and that will produce a cataleptic-like state that causes the patient to be dissociated from the surrounding. It has a direct action on the cortex and limbic system. Hence, a non-competitive NMDA receptor antagonist that will block the glutamate. It reduces polysynaptic spinal reflexes, and in low dose, you will have a nerve analgesic effect. Examples of where and when we can use ketamine will include agitation. But in this case, you have to go by hierarchy of medication to be used. First of all, try benzodiazepine like lorazepam alone. Or you may choose to go to the second level, which is benzodiazepine with antipsychotics. But have that meaningful conversation with psychiatrists in your region. If you are not winning with the first or second steps, then go to the third one, that is, you are dealing with refractory agitation, then come for ketamine. In that case, you can give ketamine intravenously at 1 to 2 milligrams per kilogram over 1 to 2 minutes. You can repeat half of this dose after 20 minutes of the first dose at 0.5 to 1 milligram per kilogram. You may choose intramuscular route, and in that case, you go for the dose of 4 to 6 milligram per kilogram once. But you have the luxury of repeating half of that dose in the next 25 minutes, meaning half of 4 to 6 milligram per kilogram will be 2 to 3 milligram per kilogram after 25 minutes of giving the first one. In pain treatment, you may choose subcutaneous anesthesia dose, and you may choose intravenous dose like 0.25 to 0.5 milligram per kilogram bolus, followed by infusion at 0.05 to 0.25 milligram per kilogram per hour. In chronic pain, you can use ketamine, but please contact your pain specialist to guide, because the dose they're going to use here will be different from what they're going to use in acute pain. And also, when you are using intramuscular route, that is the previous slide, remember, you're going to give it deep into the muscle and you're going to choose a large muscle mass. Other situations where and when you can use ketamine will include opioid-induced hyperalgesia or opioid-induced tolerance. So you can use ketamine. In refractory pain, you can use ketamine. In severe depression, as a general anesthetic agent, in general anesthesia, yes, and mechanical ventilation, can use it. Lastly, you can use ketamine in procedural sedation, in rapid sequence intubation, in status epilepticus or refractory epilepticus. With that, I've come to the end of this short presentation on ketamine. This is a very good anesthetic agent that could be used to so many things, so many procedures, office-based or theater-based procedures. Thanks for listening. Remember to share this very presentation. Remember to subscribe to my channel so that you can get all my presentations immediately they are published. And you are free to leave your comments, but let it be fact-based comments. Thank you.